Hello, this is my presentation of Community Health Plan. I'm Nicole Taylor with Horizon University. This is for Community and Public Health Nursing with Professor Susan Austin. Let's get started. So, care for our senior community is the utmost importance for me. I do feel like our seniors deserve proper care and a great way to spend the rest of their days after retirement with love, socialization, health, and peace. During my research, I found that senior depression is roughly 14% of adults is over 60 years, and that is found on WHO 2023. Cited it right there for you. So I've chosen health-related topics which lead to depression to help combat the symptoms. I'd like to talk about combating the depression and anxiety in seniors, just healthy living, mind, body, and spirit. The community I chose is a 55 years and older independent living facility. The people that reside here are mainly over the age of 65. They still drive. They are very independent. They cook their own food. They clean their own homes. Um, they decide whether they want to come out for activities, and the activities are mainly coordinated by the executive director, who's my liaison, Tammy Bennett. They do have a community nurse that comes and visit monthly for screenings. So she mainly screens for blood pressure, heart rate, um, pulse oxygen, your normal vital signs, weight. She'll give them resources and offer them advice, nursing advice, and just to keep a check on them and say, hey, did you visit your doctor? Did you, go to the eye doctor or the dentist? Are you wearing your dentures? Are you using your assistive devices that were prescribed to you? So I think that's really nice. Um, I chose this community because I have a fondness for our seniors. I'm very grateful to them, and I feel that they are responsible um, for a lot that our generation is able to have. Uh, some of them really feel like they're a burden and washed up and forgotten about, and that can cause a lot of anxiety and depression for our seniors. So I just wanted to talk to them about ways to combat depression, try to live a healthy life. We went over a lot of things to help them just to create a healthier life. I met a retired lawyer, a retired teacher, a retired doctor. Some of them are widowed. For instance, the doctor and the teacher are both widowed. And some of them are still married and live with each other in this community. Some of them are married have the spouse next door in the neighboring community for assisted living and dementia. Um, so I think that we all should be grateful to our seniors for what they've done and try to help them age peacefully and focus on their mental health as well as our own. Here are some of the slides that we went over. Here's my brochure that the residents had. They really liked them. This is one of the slides we talked about with just healthy living, reminding them to visit their physician. This is one of the other slides. We went over social determinants or proven studies. I did back it up with some research. It's on my PowerPoint. The U Curve of Happiness. This is a great video to watch for our seniors because she is a senior and she talks about being positive while aging and how it's not a horrible thing. This is Dr. Henderson. He just talks about incontinence and the treatments of incontinence, so people can try and live a normal life without the embarrassment or being ashamed. So during my windshield survey, the best thing I could say is that the community was very clean. It's small, it's quaint. It does remind me of a cute Hallmark movie. I love Hallmark. And the cars are all clean, taken care of. The yards are manicured and nice. There's no trash or debris on the roads. There isn't any trauma hospitals or major hospitals that are really close. However, I would say 15 to 20 miles. Um, so if you know an emergency situation, you can get there fairly quick. They do have obviously a fire department, a police department that's close by. So there are first responders who are close by. Um, there are some urgent cares located around, so that's good, you know, if they need to go to an urgent care. Um, the the homes are really nice. Um, they're taken care of. The other issue I had was at the major roads, intersections, you know, where the highway is, there isn't a lot of crosswalks. However, I haven't really seen a lot of people walking, but I think that because they have a bus and so many businesses where people, maybe even young people work, they should have more crosswalks for safety. Um, Other than that, I had a nice time with the windshield survey and actually have been in the neighborhood quite often. So my community assessment data generation came from the U.S. Census Bureau as of the year 2023. That's the most current data that I was able to find for the U.S. Census Bureau. Population here in the town is 968 total. So you can see there's a very small town, very small place. Population per square mile is 901.9. Under the age of 5 is 6.5%, so not a whole lot of little ones here. Residents age 65 and older is 19%. Um, the amount of Caucasian people who reside in the town is 89.3%, which is pretty significant. Blacks is 2.6%. The median household income is 180,931. So it's a pretty rich and small, quaint town. Um, so it's not a whole lot happening here. So the community partners and resources isn't, these are two that the facility or the community is not already linked with, and that's the local public library or the senior center. So the senior center is in the neighboring town. There is not one located near the independent living. I think that it would be great for the seniors to have both the public library because the library, I say this because I did do this at one of my assisted livings that I was a director for. Um, the library came in and they picked a room, you know, where they could store their books for residents to rent and also supplied a computer for resources that they basically set up for the residents. So they had puzzles, they had books, they had magazines, articles, of obviously online articles. And the residents would come in and just rent it out like they would if they went to the library. They filled out a form or a ticket and they returned it. Monthly, the library will come and switch out all of the books so they have plenty of options to kind of, go through. So the residents could do that. The senior center is a great place for socialization, somewhere new. I mean, they do things at the independent living. Most of them do drive, so they do go out of town, visit with families. But the ones who don't drive far or can't drive far, I believe the senior center does have a shuttle bus. Um, but they do bus trips. They have exercise programs, aquatics, golf, like sports, other things, bowling. They have bingo night. They have concerts and plays. So many options, and so many things. And I think the membership fee is only $5 a month. So that's a really good fee to do so many good things, possibly meet new people. Not even possibly, they will meet new people because there's a lot of people who goes to the senior center. And I don't think that a lot of people outside of this neighboring town knows about it. So I did bring that up to my liaison. I think that that would be a great place for them. She is on the Chamber of Commerce board for that town, and she mentioned that there will, well, they're working on having a senior center very close to the independent living. She doesn't know when, but she's pretty confident that there will be one. Nursing diagnosis I chose for this had a few options. So this one I chose the knowledge deficit related to healthy living, evidenced by dehydration, isolation, high risk or chronic UTIs, depression, impaired mobility, and anxiety. My initial plan was to discuss depression in seniors. However, with speaking to my liaison, she explained that she didn't think that the residents would actually attend the seminar if we just focused on mental health. With the older generation, they don't really think about mental health as being something serious, or, they don't believe in depression and anxiety. So we just decided to focus on healthy living and talk about conditions which may lead to depression and anxiety, and how to manage those conditions or treat those conditions, and also talk about the effects that it might have on their mental health, which is the reasons why they should manage them properly with proper treatments and speaking with their physician or clinicians. So the community health plan, I did utilize a lot of research articles. I used CDC and the WHO. I spoke with my community liaison. I used a PowerPoint presentation and then a small knowledge questionnaire. Um, Most of this information I came up with from my own head because I have some experience, so a lot of knowledge and experience I use and just backed it up with research and articles. Interventions was a short-term goal or objective was for the residents to define health, explain the activities to increase mood and maintain positive mental health. So activities such as like getting screenings, making sure they exercise, making sure they have proper socialization, making sure they keep up on doctor's visits, and um, being honest with their doctor about treatment. We also went over that. On long term, a goal or objective is just to maintain adequate hydration, exercise, and a healthy diet. So, my conclusion for this project is translating to my audience the importance of senior health and mental wellness. Most seniors are depressed just because they are aging. We talked about that, and this can lead to development of physical illness and debilitating conditions. Uh, Resources such as Medicare should improve health-related issues, but that's a different topic in itself. Making sure seniors are aware of available resources just to help them with the level they can control, which is socialization and exercise, hydration, healthy dieting, um, to maintain their mental health. So this concludes my presentation. Here's my reference slide. I only utilize 2 references. And thank you again, Herzing. The end.